The Department of Basic Education yesterday announced that it's ready for schools to reopen tomorrow. The Minister, Mary Metcalfe, said the President would, however, have the final say. So perhaps the President will touch on that this evening in his address to the nation. The recent looting and vandalism in Gauteng and KwaZulu-Natal had also filtered into schools. The Minister had estimated that the damage to school infrastructure would be at about 300 million rand. I want to talk about the state of readiness now. Joining me live, Mary Metcalfe, who's a Senior Research Associate at the University of Johannesburg, Rahima Essop, who is the Head of Communications and Advocacy at Stop School Dropout, and Vanessa Roux, the founder and coordinator of Parents for Equal Education SA. A very good evening to you, ladies. Thanks indeed for joining us. Vanessa, I'd like to start with you. What is your reaction to the Minister basically saying that schools are ready to reopen tomorrow? I know that you'd started a Facebook page that consisted of parents as well as teachers. You have about over 110,000 participants, I understand. What is their sentiment?
Hi, Griselda, and hi to the ladies, and thanks for having me. Griselda, currently the general sentiment is that we are not ready. Our schools are not ready to open, especially from the 2nd of August. We are not ready to open up full capacity. And parents live in fear. Not only parents, but teachers also. They are living in fear. Because as we know, the vaccine is not, it's not like they prevent you from having or contracting the virus. It's just that you won't be able to get so sick. But what about the learners that's not infected? And I think it's equally important that we start this conversation. And if we have this conversation, because what I've observed is when the department is speaking, they are speaking as if they're speaking under normal circumstances. So I'm asking at this point, when we start this conversation, are we having a general conversation, or are we having a conversation with regards to COVID, the situation that we are in and that we're experiencing the third wave? So, because then it becomes a whole other conversation. And then we must equally, secondly, ask what our priorities are. Because as parents, our priorities are the safety and lives of our children. And from a union's perspective or employee's perspective, I think it should be the priority, the lives and the safety of teachers. So are we on the same page when we start the conversation? Because lately, I don't feel that we are on the same page. We are talking from two different pages. Because from a parent's perspective, my maternal instinct of protecting my child immediately kicks in when his life is in danger. So that is my question at this point.
Ms. Roux, we'll come back to you very shortly. Let me bring you in there as well, Ms. Essop. You seem to have a differing view on the basis that already the school dropout rate from recent research that has been done, I understand, gives quite an alarming increase. There's also, the school attendance, which I understand over the past 20 years has never seen this kind of absenteeism, if I can. What is your take on the Minister saying that we're basically ready to go back to school?
Well, Griselda, we support the safe reopening of schools as well as the safe return to full-time schooling for primary school learners in early August. We need to get our learners back to class because the longer they are away from school, there is the greater likelihood that they won't return. We have seen attendance rates are the lowest in 20 years, according to new data surfaced in the NIDS-CRAM survey. We also know that an additional 500,000 learners have dropped out of school since the start of the pandemic. That means dropout has tripled compared to pre-pandemic figures. Now, let's put that into perspective. We know that most young people who exit the schooling system without completing matric will struggle to find decent jobs. And for the few who access post-school study opportunities, only 1% will successfully complete a qualification at, let's say, a TVET college. So dropout affects everyone, not just the individual learner or their household. And it affects the economic health of our country because young people without a matric certificate are cut off from chances in life, chances to learn, to earn, and to contribute to social and economic life.
Ms. Metcalfe, you hear those concerns, low attendance, the figures, the lowest in 20 years, according to Ms. Essop. We also understand, this fear, of contracting the virus. How do you reorientate learners and teachers? Because that fear would obviously still exist because the virus is still there.
Thanks, Griselda. What Rahima has said and what Vanessa has said both need to be taken into account in the way that schools move forward. We know from the science that it is possible to run schools safely. But we also know from the research that's been done that there are devastating effects, not only in terms of what learning is covered, but also nutrition programs, psychosocial, people are out of school for a long time. We also know that the virus is going to be with us for years to come. What I think is the direct answer to it is that schools have, for more than a year now, been managing a safe environment. They have used their ingenuity, they have used their creativity to solve problems that the policymakers made themselves not even have. We have to have confidence that schools are going to be able to adapt to the needs of their own particular community, reassure parents that indeed learners will be safe at school because it's an environment which is controlled, which in fact can add and act as a barrier to infection. Where hand washing is happening, where there's ventilation, where there's mask wearing, the school day. That is a safer environment for many children. And we cannot risk the future of our children with prolonged school closures. So the work that Vanessa is doing with the schools is really important, and we need to be able to reassure people about what the science is saying.
But obviously the science would also be an issue, Ms. Metcalfe. Apologies, your sound is a little bit bad, but we're trying to manage that. When we move on to the other guests, perhaps you'd be able to just move around a bit so that we'll be able to get a better connection. But I mean, if you look at that versus the concerns of parents, one does understand that schooling needs to continue. The virus is going to be with us for a very long time. But the reality is on the ground that there are still some schools that are overcrowded. So parents certainly do have the need to be concerned, in particular environments like that where social distancing is otherwise going to be a challenge.
So, Griselda, would you
I think you're asking me to repeat that. Ms. Metcalfe, I was saying the reality, however, on the ground, while schooling needs to return, while learners need to return to school, there is a great concern amongst parents that the reality on the ground is actually something else, where you have schools that are massively overcrowded and, simple non-pharmaceutical interventions like social distancing are not going to be possible. How do you manage that and still continue with schooling? Because obviously that needs to get off, it has been interrupted for quite a while now.
So I think we need to have a holistic discussion, because young children are, risks of COVID infection increase with age. Children do not get seriously ill with COVID. The mask wearing is critical. Physical distancing, as much as it can be managed, is important. But if you don't take a holistic view of saying we have to have our children learning, we can't afford to have the dropouts, we can't afford to have children not learning to read and write, then we need to look at the risks, look at the advantages, and use our resources at local level to support schools to maximize school safety. There are schools that are very overcrowded. Those schools need to solve the problems within their capability and using the resources. The Western Cape Education Department, for example, has said to schools, if you can't physically distance with the resources that are available, talk to us. So there has to be responsiveness that solves problems at local level. We need to get children back to school.
Mr. Roux, you don't seem to be, too pleased at all with what the minister has announced, but you're also hearing this discussion, concerns about, low attendance. Obviously, those fears are still there. The dropout rate as well, as a recent survey has been suggesting, that has almost tripled. I mean, how do you get those learners back into the classroom? What do you want to see being done before those parents that form part of your Facebook group would be satisfied that they would be able to feel safer in the classrooms, both parents sending their kids into those classrooms as well as the teachers who have to physically be there?
I have to step in and rectify Mrs. Metcalfe from her perspective, because it's not true. It is not true, Mrs. Metcalfe. Parents have not been allowed on school premises. And let me tell you, about 2 months ago, I was invited to speak to a grade 12 class in our community. And if you say some schools in our communities are overcrowded, all of our schools in our communities are overcrowded, not some schools. The ratio is between 35 and 38. We are starting from 50 up to 60 learners in a class. And this is not something that I'm sucking out of my thumb. This is evidence I can prove to you. This is facts, I can bring it to you. About 2 months ago, I was invited, and the WCD was jumping around because innocently this teacher invited me through a friend to come and speak to a grade 12 class about human rights. When I walked into that school, Mrs. Metcalfe, let me tell you, there was no social distancing. When I walked into the classroom, these children were sharing one desk. There was absolutely no protocol. And that is not an isolated situation. That is what happens right through this province, and principals, SGBs, and all of these people are keeping it from parents. That is why we are prevented from entering school grounds. So that is not true if you say protocol are being observed, because it is not true. In the ideal world, for Model C schools, it can be observed, but not in poor disadvantaged school. And then we must go back, and then we must ask, what is the priority? Between you and Rahima, we must ask, what is priority here? Is it a piece of paper or the life of my child? Because as a parent, I can tell you, I will fight any government that threatens the life of my child. And life is a sacred thing. The constitution of our country say life over any and everything. So how do we get to, I left school 22 years ago. We haven't dealt with the pandemic throughout. You haven't dealt with the education during a pandemic. Rahima haven't dealt with the education within a pandemic. So how do you get to the point where you're putting a sacred life of a teacher and a learner above academics, above a sacred life of a teacher and a learner? That's my question at this point. If you talk about dropouts, Rahima, let me just tell you something. You are concerned about dropouts. Let me tell you, about 2,000 learners at this point in this province have not been placed in schools. You are talking about dropouts. Where have you been all this time? Because we were advocating publicly for them. We were advocating in the boardrooms, through departments. We have been advocating for these children, but they have been pushed aside and hope they would go away. They won't go away. Where are you each and every year when children don't attend school for a whole academic year under normal circumstances? Now, during a pandemic, we question, what is your role and responsibility? Where have you been all this time? Now, when our children's lives are in danger, you want to speak about dropouts. This is not our priority at this point. At this point, the lives and safety of our children is priority, and we are saying, look at alternatives before you throw our children to the wolves, because this is deliberate and this is criminality. That is what it is.
Deliberate and criminality is what you say, Ms. Roux. Prof, I want to bring you in there. From Ms. Roux's concerns, it seems like she and the teachers and parents who are on that concerned parents and teachers Facebook page believe that perhaps a blanket approach is being used here, where the reality on the ground, which we all know about, you know about it as well, is that in some of these schools, the situation is just not possible for you to social distance. I was once, at my time in high school, in one of those schools, and that situation hasn't changed. That's the reality that is on the ground. How do you respond to Ms. Roux and the more than 110,000 participants on that group who share the same sentiments that she does, where they believe that a blanket approach is being used here? Yes, schooling needs to continue, but under what circumstances? Certainly something needs to be done before those doors are opened.
Absolutely. The conditions across the various communities in South Africa vary greatly. Most of my work is in KwaZulu-Natal, a little bit in Mpumalanga, Gauteng, and the Free State. And I know how dire the situation is in terms of shortage of resources and overcrowding in schools, for example, in KZN. But I also know that the science that comes from the NICD has shown that there has not been a significant illness amongst children under the age of 10. The figures of whether it's 10 or 11 or 12, we can check on. But at primary school level, there has not been significant illness from COVID in young people. And we have to temper our fears and anxieties with that. In terms of the large classrooms, schools are finding solutions. Last year in the Peperufunde campaign, we had teachers and principals who were demonstrating under extreme difficulties of disadvantage and large classes. They were finding solutions. So I really believe that we need to support schools, develop strong working relationships with school governing bodies, work with our teachers who by now have been offered the vaccination, and about 70% of teachers have taken advantage of that opportunity. Majority of teachers over 40 have been vaccinated. We must keep schools safe. We must keep learners learning, because the very communities that Vanessa are talking about are the communities where it's least possible to learn effectively at home. So I think we're on the same page. We want learners learning. We want safe schools, but let's do our best to make it work.
Ms. Essop, how do we then deal with the mental aspect of it? While Prof correctly speaks about the science, what the science says about the infection of younger children, but the fear element is still there. And obviously teachers as well as learners would need to be mentally prepared to go and effectively teach and learn in these classrooms. How does one deal with that versus what the science says? Because the fear and the anxiety is certainly something that needs to be dealt with if there's going to be effective learning and teaching that is going to happen in our classrooms. How's the balance going to come about then?
Well, Griselda, I think the balance is really important, and we need to make sure that in all of these schools they are capacitated to be able to ensure that COVID safety protocols are in place. So if there is social distancing as much as possible. And I support what Mary said about schools, despite their circumstances, taking initiatives and doing things to be able to ensure that learning can take place as safely as possible. Now, look at the repercussions of learners at home without any access to distance learning options. They become disengaged, and the likelihood of them dropping out then increases. We talk about dropout as a process of disengagement in which a learner is pushed or pulled away from school because of factors in their home, school, or community environment. The pandemic has been devastating on these learners. They come from households where parents have lost their jobs, where they have been hungry for days on end. We know this from the NIDSCRAM survey showing that hunger has increased. These learners have not had access to school meals, which they were used to. So there has been a devastating impact of the pandemic, and now they are at home. And when they return to school, we need to make sure that that happens safely, so that there is that balance. And for those who have been away from school for a long time, there has to be a reorientation for them. So the things that need to happen to ensure that learners are supported, that we create safety nets.
But are those all in place? I think it's an indictment on its own on the basic education department that at the start of the pandemic, very well knowing that obviously, the learners would need to be at home, they would need to participate in online learning classes, that some of the homes, majority of the homes in this country, don't have access to that kind of material. But I'm sure, with what Ms. Roux had basically said was that you have a situation here where, the cart is basically being placed before the horse, in that there are certain things that you are also saying should be put in place, but that should actually happen before the school doors are opened again.
We've said from the beginning that the conversation shouldn't be around whether schools should open, Griselda, but how we can school safely. That should be the conversation, not whether they should open. The repercussions of learners staying at home without any access to schooling, and the impact that will have on them and their families and their future prosperity, that's something that we need to take into consideration. Now, in terms of when schools reopen and the protocols that are in place, that obviously needs to happen, and schools and households need to work together to be able to ensure that learners return safely. And there are things that we can do to ensure that they return to class, because we have seen, as I mentioned earlier, low attendance rates. So schools can leverage community structures like churches and street communities to urge learners to return to school and to trace those that are unaccounted for. Schools can use community volunteers to track absent learners by going door to door so that they can return to schools. Schools should have a dedicated team to monitor reintegration efforts. And we've always said, as the Zero Dropout campaign, that we need to strengthen psychosocial support to be able to build safety nets around our learners, because they are coming from households that have been deeply impacted by the pandemic, and therefore they would need counseling and a mentor to be able to get them back on track so that they are able to focus on their schooling after experiencing difficulties and challenges at home.
Ms. Roux, you had basically earlier on spoken about how soup kitchens had been started in your communities to try and deal with some of these challenges. Talk to us a bit about that and, your response to what Professor Metcalfe as well as Ms. Essop say about the dire need for schools now, not the fact that if schools should reopen, but how that should actually be taking shape.
Griselda, just to come into what Ms. Essop is saying, she is speaking about the low attendance. So I'm asking her at this point, based on what is your facts that there is low attendance? Because you can't have a survey at this point, or even since the pandemic started, because we had options as parents whether we wanted to send our children home to school. I'm one of those parents that didn't send my child to school. So based on what? Because you had an option whether you want to send your child to school, whether you can learn from home. Obviously, if half of the children is learning from home, there will be low attendance. They will only go to school when they write tests and exams. So based on what is your research? Based on what? How did you conduct your research? Because half of the children was at home. Half of the children, in fact, they were on a rotational program. So based on what did you do your research? How did you conduct it? And secondly, Mrs. Metcalfe, just to add to you, you say children don't get sick. That's a myth. That's not a fact. That's a myth. That's the biggest myth. And you know what? As parents, we were caught off guard. We were caught with our pants down, because while government was saying to us, and I'm only speaking about the Western Cape, in April, when government was saying to us all the while children don't get sick, when we got to the figures, not our figures, figures from the health department, Over 11,000 children were already infected. Where 37 of them died. That's the things they didn't tell us. That's the thing they are not transparent. So how do you expect collaboration and partnership with a government that's secretive and a parent that expects transparency? Because at the end of the day, that's two whole different things. Then you are speaking to the effect of feeding schemes. Do you know that is such a humiliation for our people? And I want academics to stop doing that. Stop insulting our communities in that way. Stop insulting our people in that manner. And with that, I'm not saying there's no challenges, but I'm saying you can never compare a plate of food to the life and the safety of a person. It's disgusting that academics do it, and it's disgusting, it's dehumanizing that we allow academics and researchers to get away with these type of arguments. Nothing can be compared to the life of a child, absolutely nothing. So at this point, I'm saying, let's be truthful with each other. Let's not spin around, because here we are speaking about life and death situations. You are doing research from behind your laptops. Come, let we as activists in any province, your grassroots activists. I just want to ask Mrs. Metcalfe and Rahima, when was the last time you have physically visited the school?
Oof. Shall I come in? I'm very keen to.
Yeah, Prof, please do. And after that, I would like to bring you in as well, Ms. Essop. I'd love to give you the opportunity to respond. Doing research from behind the laptops, these parents say.
So firstly, I work in KwaZulu-Natal in schools. I've been doing that in support of an improvement in learning outcomes in KwaZulu-Natal, and I go to schools across the province. This year, I have not been as much because of the lockdown, but the team of people I work with in Pilo will be in schools next week, every day across the province. So there is substantive experience of working with schools and particularly with teachers. Now, let's come to the question of how do we know that children have dropped out. This is not anecdotal. The CRAM survey looks at people across the country and asks the question, in your family, has a child left school and not returned to school this year? And the figures that Rahima has presented are scary, because dropout is one of the major challenges that we have in this country, where we lose young people to schooling permanently. So the CRAM survey is a national survey. In terms of the sense you have that young people are getting ill, the National Institute for Communicable Diseases publishes and has published articles which show that while older people are getting sick, younger children who may be asymptomatic are not getting sick at the same level. The illness rate is much lower. That doesn't mean nobody gets sick who's young, but the levels are much lower. So these are not lies, and I would say that I share your absolute passionate commitment that all our children should be well and that schools should function safely. But the evidence is solid. It comes from the NICD, it comes from the CRAM survey, and we need to reassure parents that on the basis of proven scientific information, the safest place for them to be with, for their children to be, is actually for the majority of children whose families are not able to provide structured learning. I'm glad that you can do it for your children. It's wonderful, and it's your right to do that. But for many families, they are not caregivers at home who are able to provide a structured learning environment. And then our teachers step in, and we do that in schools.
Ms. Essop, I'd love to give you a right of reply to that as well. Ms. Roux basically saying that the reflection of what you're saying is not what is on the ground, and in fact, they're very concerned about the stance.
Sure. Thanks, Griselda. So as the Zero Dropout campaign, through our implementing partners, we work with around 27 schools in 3 provinces, KwaZulu-Natal, the Western Cape, as well as the Eastern Cape. We have 2 programs, the Reading for Meaning program that is currently operating in the Eastern Cape, where we work with learners to help them to, grade 5 learners to help them to read for meaning. We also have a program called Year 2 Network of Schools, and I recently met with teachers as part of our initiative to activate teachers and create champion teachers in various schools so that they can run dropout prevention campaigns in those schools. And during those activation workshops, teachers did not mention to me that they were anxious about schools reopening. None of their anxieties were aired. Yeah. In fact, some of the concerns were that learners were not returning to school. I spoke to a teacher in KZN who said that she's very concerned about the attendance and that she has been trying to get these learners back into class. Yep. So I think that we need to move the conversation forward into what are the solutions? How can we get our learners back to class? How can we make things work?
Mm.
Ladies, thank you very much. We really do appreciate your engagement here on the programme. Very insightful. Of course, different sides of the fence. Some saying it's a good time for schools to reopen, and others believe that we could wait just a little bit longer. Mary Metcalfe, Senior Research Associate at the University of Johannesburg, Rahima Essop, Head of Communications and Advocacy at the Stop School Dropout, and Vanessa Roux, who's the founder and coordinator of Parents for Equal Education South Africa. Thank you very much indeed for joining us.